It is one of the, madam was telling, Wahida madam was telling, no, infertility is a lucrative business. So Garbha Sanskara is also going to be like that. And we have to exploit it before our counterparts exploit that. Because you can see in every nook and corner, when you go there, the modern nursing homes, they are giving the Sanskrit names. Suraksha, Matritva, Surakshit, Prasav, like that. And Garbha Sanskara is also a word hijacked by our contemporary practitioners. So it is the sole property goes with the
Ayurveda.
Ayurveda, exactly. It is the sole property of Ayurveda, and we have to exploit it at its full length and scope. So that is the motto of my presentation. So we know that Garbha Sanskara, as such, the word is not there in Samhitas. It is mentioned under the Shreyasi Praja program in the Samhitas. First ever we see this description in the Charak Samhita. I am not going into details of all the Shodash Sanskara because of the paucity of the time. But let me tell you that if you observe my slide here, 80% development is completing in utero. But the precursor, what we need is the bija should be in the proper form. Optimal development of gametes are essential for the well formation of the fetus. But as far as the development part is concerned, 80% development is happening in when the fetus is inside the uterus. So we have to utilize this 9 months time efficiently to form the optimal grown baby. So that is the asset of the nation, asset of the world, asset of the globe. So we can contribute a lot in that respect. So what is the fetal programming? There is a theory proposed by the Barker. It is called as the Barker's hypothesis. You can see here, he postulates that a number of organ structures and associated functions undergo programming during the embryonic and the fetal life, which determines the set point of physiological as well as the metabolic responses that carry into the adulthood. So now you understood that, now why it is essential to program the fetus for its optimal growth. That is the fetal programming. So Shreyasi Praja or the Bija Sanskara as well as Garbha Sanskara together we are considering under the Shreyasi Praja program can be called as the fetal programming. Sorry. So the fetal programming, it is approved by the WHO. They call it as the preconceptional care. It is incorporating so many things. You can see here in this slide that so many modulators are there, so many external factors are working on that, affecting on the fetal growth and development as well. So many, this I am skipping because there is a paucity of time. So some example I can show here, the maternal undernutrition is leading to the type 2 diabetes mellitus in the baby. And this is more essential for us now in India. Every one person among the 3 is diabetic now in India. So we are the capital in India, capital of diabetes of the world. India is the capital of diabetes. So more so we need fetal programming. This is example only. And low birth weight, and there is a correlation with the heart disease. So these two are the examples. There are so many examples are there. So the Garbha Sanskara or the Shreyasi Praja, the antenatal fetal optimization development program, and WHO defines it as the state at birth in which the neonate is most likely to survive and thrive through the neonatal transition and infancy, and to be prepared such that early developmental effects do not impact negatively on the individual's life course. So WHO is also giving the definition what is the fetal programming or the antenatal fetal optimization program. But the modern perspective is different. You can see here WHO, 2 things it is showing importantly: nutrients availability and the environmental and intergenerational factors. So intergenerational factors again affecting the baby and its offsprings, baby's offsprings again. So Madam was also, Srikala Madam was also talking about the intergenerational effects in the morning talk. So we know that very much, nutritional factors, external environmental factors, how toxins are becoming these endocrine disruptors and all. They were talking how they are influencing the gene sequence expression. Not the it's not the sequence. The functioning of the genes or the expression of the genes are getting affected because of these factors. So Sanskara is in every this thing crucial. Samhitas are mentioning the Sanskara. So what is the term's meaning? If you see in other contexts, Bija Sanskara is mentioned there. So there is a clue for the Bija Sanskara for us. And Shreyasi Praja, whatever we are doing the Garbha Sanskara, we have classical basics. So whenever I am taking Viva or some other context, I will ask definitely what is the basis. If it is there in Samhita, Gokumar sir was telling, try to understand whatever mentioned in the Samhita. So if you try to look into the deep meaning of these slokas, I am showing in these 3 slides. So again I am repeating. See, this is the basis for the Shreyasi Praja program. You can see here Shreyasi Praja Michito, Shreyasi Praja Gunavan Putro Gunavati Cha Kanya Abhipreta. It is not the male baby we are trying, for both. It is applicable for the both. Shreyasi Praja means Gunavan Putro or Putri. Kanya, it is denoting to the Kanya also. But the Gunavan, what does it mean Gunavan? With the optimal qualities. Gunavan means the optimal qualities of the baby. What are the qualities mentioned here? Acharya Susrita mentioned that Vidhipurvakam, if you perform this, what you are going to get, or the baby, Garbhasya Phalam Darshayanaha. The Phala we'll see in the Garbha are the Rupam Atra, not simply the external Rupam he is telling. Rupam Atra, Abhayava Sannivesho, Lochana Sukhapradaha. It's pleasant to see, pleasant vision will be there. It's not the so beautiful, he is not meaning that. Okay? And Sattvavanto, Sattvavan, Putra or Putri will be, and Runasya Mukta. This is different part of the spiritual story of the Garbha Sanskara. And one more additional you can see here, and one sloka I missed here, that is the often we search what is the basis for the listening of music, what is the basis for the Vyayama, what is the basis for the Mano Anukula Katana, and what is the basis for the creative visualization or the Garbha Samvada in the Garbha Sanskara. So that is there in Charaka Samhita, the sloka I missed here. That is from the Jati Sutriyam, Charaka Sharira 8th chapter. Mano Anukula, Katha Sravanam, Raga, etc. are mentioned there. So that is the basis for us to take up as a part of protocol Garbha Samvada, Raga Sravana, etc. Next comes the Vagbata, if you see, from the Hrudayam. So it is the Yatrasam Putra Michetam, Aapko jaise putra chahiye, hai na, Kamayetam, Tadrupa Charanam Rupam Varna, Samsthana Pramana, Shakrutyadi. So in a similar way, make a picture of that or visualize from your brain how your baby should be, how the eye should be. It's like the Bhanupriya, or it's like the someone else, or it's like the Mohanlal, or it's like the Mammootty. You have to visualize. That mother has to visualize how the eyes. Similar way, everything she can visualize how the hair must be. If she is visualizing the female fetus, hair must be long like the Asha Sridhar madam. Something like that. When you see someone, it will catch your attraction that so my baby should have like this, like that. Ajana Bahu Aravinda Netra, some descriptions we see in the classics of Indian literature, no? Rama is like that, Krishna is like this. So all the good quality, physical qualities also we see there. So mother can visualize like that, and there is a basis in the Samhita how or what she can or he can do. Even for the acquirement of the color, so whichever color they prefer. Of course we favor more for the Gora, na? So, and these tinges are different from Kerala, from North India, from North Eastern India, and the Southern India, and the extreme the Western India. So different flavors are there. Colors are there. So accordingly they can have, and it is suggested to decorate the house like that wherever she is residing. So if you observe the Masanmasik Paricharya, every white preparations are mentioned there. Payasam, Kshiram, Navanitam, Ghrutam, course Ghrutam is bit different, and the bed sheets, curtains and painting of the wall, it is mentioned to be white in color. And Shukla Vastra Dharanam, daily she has to wear the Shukla Vastra. So it is maybe having some, this is a topic of research, how the color is developing. So Garbha Varna Nirmana, it is based on the whatever she is visualizing. So all the classical references are there, whatever we are taking up the protocols. That is the motto of presenting this slokas here. So with the Nirmana Kala we perform the Bija Sanskara, during the Garbha Nirmana Kala we perform the Garbha Sanskara. But the target is, you have to keep in mind, these are the points of your target, right? So there are other examples also, how we can go for the we can establish the Barker's hypothesis, fetal origin of adulthood disease, right? So I am skipping all this because we have a demonstration, important demonstration. So practicing protocol at NIA. We are different institutions, we are performing the Garbha Sanskara. I know there is a good room decorated for the Garbha Sanskara at Goa, at ITRA Jamnagar, and IIA Delhi also on the way, and we have also prepared our own room, and many other colleges, they may be having, even the private colleges and the private practitioners. I know I have seen Pune madam, the name I have forgotten. The decoration is so it's attractive, and it is like the traditional this thing they are decorating the nursing home for the purpose of the Garbha Sanskara, and that is needed because Mano Anukulata must be there when the patient is undergoing the Garbha Sanskara program. So we have also decorated like that, and we have devised one protocol at NIA to follow. Based on that, we have taken up the studies also. So today we actually you have to focus on these three. Madam was telling that Bija Sanskara, it is there, Garbha Sanskara, it is there. Whatever we are doing. But in the additional name, what others are doing, that we are unable to follow. That we have to take up, and prominently we have to practice it. So Yogasana we know now that Morarji Desai came up with a national protocol for the pregnant women. So you follow that. You need not to devise something else. That is the SOP, you can take it, consider and follow that protocol. So I am not focusing on the Yogasana. My focus will be today on the Dhyana, Mantra, Raga Sravana, Garbha Samvada and Vyayama. Vyayama is also there. Mridu Vyayama is mentioned, but different aerobics and all, western side they are performing. The mother who is going to deliver, and their focus will be, their focus will be on the achievement of normal delivery, not the cesarean. But we people, our cesarean rate is high based on the textual indications and our social backgrounds, right? So next 15 minutes we are going to have. So I am skipping the Yogasana, right? And even IIA Delhi brought out the SOP. It is Yogasana setup protocol is mentioned in that SOP also. That is there in the website of IIA Delhi. You can access it. And the Yogasana allowed for the pregnant woman is there based on the trimester also. First trimester, second trimester. I think Meenakshi is right. Is there. So you can access it. Next comes the mantra. We have ambiguity. So when I go some institute, I hear that some people say that Gayatri mantra, they can listen. Some people say that Vishnu Sahasranama is the best one. So like that, different institutions, they are having their own design of mantra. What I believe, Maha Mantra is the Om is the best mantra. Simply you can ask the patient to perform, and there is no religious objection also on the Om, what I have seen in our practice. So whatever the religion, they simply accept. Om chanting is no objection for them. The remaining mantras, I say that whatever you have in your religious texts, you chant that mantra, because we don't have knowledge. So if we, in future, if we come up with those mantras also, we'll definitely ask them to adopt that. So mantra, high risk pregnancy, there is an example I can show that listening to the enchanting of mantra and meditation can prevent the patient going into the pregnancy-induced hypertension, consequently pre-eclampsia and the eclampsia. So this is the first trimester, second trimester and third trimester wise mantra protocol what we follow in our institute. And there are some other mantras when you are targeting the baby to develop mental or the memory faculties. like that, and Sarvangina Vikas, that is the complete development of the organ systems. Then you can go for the Purusha Suktam. Like that, there are so many, the ocean of mantras are there with us. So you can adopt like that. And some creative visualization, creative works also you can ask the patient to perform. So there are links of mantra given here. And the recent addition in our protocol is the Prajna Vivardhana mantra. So quickly I will finish my presentation and demonstration will start. And there is a study that it is stating that uterine artery resistance and pulse tail indexes are helpful in predicting the PAH and preeclampsia. So based on that, in one case we have given dhyana prescription and chanting of the Om daily, morning and evening for half an hour. So religiously this patient performed, and she was having the first pregnancy, she was having the history of PAH and consequently preeclampsia, and this pregnancy also risk is detected early that PIRA elevated. So we have started this, and of course we have added Arjuna also. Arjuna Jatamamsi was also. All 9 months religiously the patient was taken, and then only one episode of elevation of BP we have observed, that is during the labor. And labor was normal, it was uneventful delivery. So peacefully patient delivered, and she never went into the PAH mode or the preeclampsia. So these are the examples what we have given to that patient. I think dark it is there. So you can see here her reports. So this is our setup, the Garbha Sanskara setup. Many of you might have visited our Garbha Sanskara unit. So this protocol, whatever we have written, accordingly we will give the Garbha Sanskara. And coming to the Raga Sravana. So according to the Acharya Charika, Mana Anukula Katana and Raga Sravana is also mentioned there. So what ragas to be taken and how we can ask the patient to perform. This is again many questions are there. Usually I hear from the students and the practitioners how. We have our own doubts that whether we can apply it to the headphone to the abdomen or to the over the head, or which mode we have to adopt. So for that also there is answer. So this is the mode you can adopt, and there is a basis for the adoption of microphones or the headphones. So ragas are proven that helpful in the cognitive development of the baby. So there are certain examples of ragas. These are already tried, like the Raga Kalyani, Raga Yaman, Raga Kedar, Raga Bhopali, and Muru Bihag. So instruments like in our yoga this thing hall, they play bansuri. One day I went and I observed that why bansuri is playing here. So I went for meditation to our yoga hall, Swasthavrita department. And that girl, she was playing bansuri to the patient. I asked why you are. So she is having some psychological kind of anxiety, madam. So we are asking her to listen to the bansuri. So it was so pleasant. So and it is applicable to the pregnant woman also. She is also under the stress always. So bansuri is best bet, I believe. And when it is coming to the South Indian part, veena can be adapted. Veena plays also. It's a soothing. The veena voice is. So sounds are muffled by mother's tissues and amniotic fluid, and the fetus consequently it listens to the sounds. Fetus primarily hears low frequency sounds, including the mother's heartbeat, the digestive sounds, and the voice of the mother. External sounds like music, particularly lower tones and rhythmic beats, she can hear. So how they react, how the fetus is reacting. It is observable by ultrasound and include changes in the heart rate. We can see, one of my patients was telling, when she is dancing, she is the Zumba trainer, and during the pregnancy period also, she has not stopped. And when she is listening to the beat music, and the baby is to dance, she is literally used to complain to me, madam, I am performing, this is my, I can't help it, I have to give the training. But that time baby is dancing inside, means that much of hesitating movements she might have perceived. So baby is responding. So startling her body movements, kicks and jerks in response to a sudden loud noise may be there, and calming effects to familiar rhythmic sounds are there. If mother daily she is practicing Garbha Samvada, so probably baby may be, particularly we can apply when the patient is coming in the last trimester with the exaggerated movements of the baby. So in those we perform all kinds of tests and we don't find found anything, everything is normal, but still movements are high. So we'll be afraid, no, why these movements. So in those cases also, we ask the patient to perform the Garbha Samvada in that particular case, and we get the result also. So there is an impact of sound stimulation during pregnancy on fetal learning. A systematic review done by the modern pediatricians and published in the BMC Pediatrics. So they have 30,000 kind of sample they have reviewed, and they have published this. So it is quite interesting to see that inclusion criteria, clinical trials and fetuses of healthy mother. This is the criteria and methods they have adopted for the systematic review. And 8 studies finally they have selected, carried out between 1986 to 2020. So, and consequently they have followed 535 neonates, 252 in control group and 283 in the study group. Overall quality of the studies, it was high risk of selection and detection bias they have ruled out. And the test they have adapted, ECG, neonatal ECG, neonatal EEG, habituation test and the behavioral responses they have studied, means reviewed for the systematic review. And the sound stimulation, music, piano, melodies, instrumental music and rhythmic music were taken up in those studies. And the speech phrases. So whatever we are telling the Garbha Samvada, the phrases they have selected. And the studies showed the stimulated neonates learned or remembered the prenatal sound stimulus, performed better in a neonatal behavior test. So the conclusion is sound stimulation can form stimulus-specific memory traces during fetal period and shape the neuronal reactions to sound stimuli. So we can understand that positive sounds and low beat sounds, melody, we can ask the patient to listen, and definitely that is going to help in the cognitive development of the baby. So we can bring down effectively the retardation of the nervous system. And the headphones, in these studies they found that headphones, what they have used in the study. So they, in the 4 studies, listening loudly in 4 studies they have seen, and via headphones in 2 studies, and by devices on maternal abdomen in 2 studies. So in both the methods you can adopt to show the, and there is other study carried out, music and singing intervention during pregnancy on maternal well-being and mother-infant bonding. It was a RCT, it was carried out in the China, and 172 pregnant women took part in the prospective randomized 3-armed study it was. So depressive symptoms, self-efficacy, maternal well-being and all assessed in this study. The results regarding immediate effects, both interventions showed positive effects on the emotional state, stress and the bonding. Additionally, the singing group showed a larger reduction in cortisol and a larger improvement in valence than the music group. So the study is helping even for the maternal well-being, listening to the music is helpful. So music, auditory stimuli and the fetal memory. So another study carried out, the fetus can hear music in the womb as early as 16 weeks of gestation and respond directly to the, by opening their mouths and moving their tongues. Maybe it is trying to produce the sound. So this is the study they have seen. This study crux, I tell that in this study, Shenzhen, China, the study Longhua district, they have carried out and 171 kindergarten, the children, and they have retrospective analysis they have done, both antenatal music training and maternal talk to the fetus. So maternal talk is the Garbha Samvada. So the results associated with a broad reduction in the autistic-like behavior. So we can reduce the work to the comorbid people. Autism spectrum disorders, effectively we can bring down when we subject the patient to listen to the music or the melody or the instrumental music or singing songs. So next comes to the Garbha Samvada. So a study carried out, mother-fetus interactions with the maternal talk, tactile stimulation, how we ask the patient to perform. So how we ask the patient, no, keep your hands over your abdomen, means tactile stimulation we are asking her to place, and then she will start talking to the fetus. So a study carried out on 52 first pregnancy couples visiting 2 medium scale obstetric clinics located in the Guangzhou. Again it is in the China. So they are also performing maternal talk there. Not only we the Indian people. So two groups, experimental group 25 couple and the control group 27. The experimental couples were provided with a TAGE program for 4 weeks. Post-treatment maternal fetal attachment assessed, paternal fetal attachment and motherhood significantly increased in the experimental group as compared to the control group. So Garbha Samvada again is very helpful. So the next step is the last trimesters. We want to prepare the patient for the normal delivery. So we have initiated a RCT, the protocol with the classical dance therapy and maternal and the fetal outcome. So there is in Bharatanatyam there is a pose called as the Aramandi, that is the Ardha Mandalam. It is called as the Ardha Mandalam. So the enrollment started in this case, and we will show this is the Aramandi posture. Before that, loosening exercise will be performed by the patient, then she will perform the Aramandi practice. So this will facilitate the pelvic joint loosening, so we can go for the normal delivery. So that is and when we have published a survey study on this. This is about the 4-5 important steps. And now I request Dr. Premraj Kairnath to coordinate the demonstration. We have persons specified having skill on that. Now I request Dr. Mauli Vaishnav from Parel, Gujarat. She will give performance on the raga. How she will train the listening to the raga or performing the raga. And mantras, I think, can I show the mantra? Can I show the Prajna Vivardhana? That is there in the YouTube. You can also listen Prajna Vivardhana mantra and Purusha Suktam, Meda Suktam. Based on the time, okay. So now I request Dr. Mauli Vaishnav and Dr. Premraj Kairnath to coordinate the demonstration. And the voluntary participants are PG scholars to act as a pregnant woman. And Dr. Sweta, our PhD scholar, she will coordinate the Garbha Samvada. Whatever we have recording for the Garbha Samvada, the demonstration will be there. And lastly, we will give the demonstration, video demonstration of Aramandi practices of Bharatanatyam during the pregnancy.
Namaste and good evening. So, scientific insights for Garbha Sanskara are really exciting. But what about practicals? When it comes to practicals, we really need to get the real things to perform real world practices. And when it comes to Sangeeta Shastra, we are not the experts. Regarding this, we are having some experts or faculties within us, and I would like to invite Dr. Mauli to conduct the session on Sangeet or Raga. Dr. Mauli is a Sangeet Visharad vocal, and she is faculty from Parul Ayurveda University, Vadodara, Gujarat. Dr. Mauli.
First of all, for Garbha Sanskar, we are using different ragas such as Rag Kedar, Rag Kalyan, Rag Gopali, Rag Maru Bihag, Rag Todi, Rag Ahi Bhairo, etc. So here first I am demonstrating Rag Kedar with audio, some instrumental audio, and with that I also will be chanting.
When we think about Garbha Samvada is again a technique where you need to know the details of communication with proper detailings which are matching the frequencies with Garbha, and these detailings are so important that we again need to learn it in depth. So this technique is being demonstrated by Dr. Shweta Raturi. She is a PhD scholar from NIA Jaipur, and she is a CCRS project officer from IIA Delhi. I would request Dr. Shweta to demonstrate Garbha Samvada.
Thank you, sir. Good evening, everybody. So, we will quickly walk you through the NIA protocol for Garbha Samvada. So, before directly jumping to that, Garbha Samvada is a sacred communication between mother and the growing fetus, nurturing the bond even before birth. It highlights how thoughts, emotions, diet, and environment of the mother influence the developing fetus. Garbha Samvada is the subtle exchange of energy, emotions, and consciousness that shapes the future child. It emphasizes the mindful communication, positive emotions, and sattvic lifestyle to support the fetal growth and neuropsychological development of the fetus. With this conceptual background, we will now move towards the demonstration of Garbha Samvada protocol as we conducted in our Garbha Sanskara unit at NIA. We have with us Dr. Nidhi, Dr. Neha, and Dr. Prachi, and acting as Garbhini, doing the Garbha Samvad.
So we have our recorded version in association with All India Radio. We have prepared the script as a part of one study, and we got it recorded. So with a professional dubbing voice, because we cannot perform. And that is there in our YouTube channel. So everyone can access it and you can utilize it. There is no problem in that.
अब संगीत की लय में हुए अपने बच्चे के अस्तित्व को अनुभव करना है। उसके चेहरे के अलग-अलग अंग।
You have to listen to that voice and you have to perform or you have to imagine your baby.
अब कृपया अपने मन को इस संगीत स्वर में केंद्रित करें। अपनी आंखें बंद रखिए। अपने दोनों हाथों को अपने पेट पर अत्यधिक प्यार और अधिकतम आनंद के साथ धीरे से रखें। अब संगीत की लय में रहते हुए अपने बच्चे के अस्तित्व को अनुभव करना है। अपनी कल्पना से अपने बच्चे का रूप जो आपने बनाया है, उस रूप को मन में देखने की कोशिश करें। बच्चे का संपूर्ण रूप आंखों के सामने लाना है। सिर से लेकर पैर तक बच्चे के हर अंग की कल्पना करेंगे। शुरुआत सिर से करेंगे। उसका चेहरा, उसके चेहरे के अलग-अलग अंग, उसका माथा, भौहें, उसकी आंखें, उसकी नाक, उसके होंठ, उसके गाल, उसके कान। अपने बच्चे का संपूर्ण चेहरा अपनी नजर के सामने लाना है। उसके रूप को मन में बसा लेना है। नीचे आते हुए उसका गला, दोनों कंधे, दोनों हाथों की उंगलियां, उसकी छाती, उसके दोनों पैर, पैरों की छोटी उंगलियां, उसकी पीठ, सिर से लेकर पैर तक अपने आप को बच्चे के मन के साथ एक रूप करना है। आपके बच्चे के मन में उत्पन्न हुए भावों को जानने की कोशिश करनी है। अब आप अपने बच्चे में सर्वोत्तम गुणवत्ता की कल्पना करेंगे। कुछ लोगों के लिए ये ऐसा होगा जैसे कि मेरा बच्चा उच्चतम बौद्धिक क्षमता वाला अच्छा इंसान, एक नर्तक या डॉक्टर बनना चाहिए। भविष्य की कल्पना ऐसे करें जैसे कि आप अपने जीवन के उस पल का आनंद ले रहे हो, जैसे आप अपने बच्चे की जीत का आनंद ले रहे हो। आपके विचारों से बच्चे के मन में उत्पन्न हुए विचारों को अनुभव करना है।
इसकी ये पूरा लंबा है, हमने थोड़ा एक पोर्शन ही आपको सुनाया। ये इसमें बहुत सारे शामिल है। सो आप जब एक्सेस करेंगे हमारे यूट्यूब को, सो यू कैन हैव फुल एक्सेस, बट उसकी एक ही कमी है, इट इज़ देयर इन हिंदी। सो आपको अपना रीजनल लैंग्वेजेस में करना है तो यू कैन ट्रांसलेट इट एंड यू कैन यूज़ रिकॉर्ड करके आप अपना यूज़ कर सकते हैं। सो हम पूरा प्ले नहीं कर रहे ड्यू टू द पॉसिटी ऑफ टाइम, एंड वी विल मूव ऑन टू
Thank you, Dr. Shweta, Dr. Nidhi, Neha, and Prachi. Now, moving to next part, Bharatanatyam. As in the presentation, we saw that the Bharatanatyam position itself helps to get the pelvic organs in alignment so as to the birthing process. For this, routine practice of Bharatanatyam steps is really good for the patient who is happy to do that, and this will be displayed in the video format. Let us go through that.
It is performed by our PhD scholar Dr. Nidhi Chikramani. She is a classical dancer, Bharatanatyam dancer. Some of you may be knowing her, maybe your junior or senior. This is the practice you can see, and now she is enrolling the patients also. अरे इसमें डिस्प्ले नहीं आ रहा है, वेट वेट She calls it, I don't know exactly the language, she says method or something, I don't know the terminology, but she is alone teaching to the patients. Also there in her YouTube, you can access.
Thank you, Dr. Nidhi, for wonderful demonstration. Moving forward to mantra chikitsa. Now we will go through some mantras as madam explained.
Meda Suktam, Purusha Suktam, there are problems with that. Chanting is also important, not only the listening. So Sanskrit is that kind of language. When you are uttering a syllable, that will invocate inside some maybe positive control or negative, maybe full beat, maybe negative, we don't know exactly. But uttering is a syllable itself is a treatment kind of thing, what I believe. So it's a technical language. So when it is coming to the matter of Meda Suktam and Purusha Suktam, it is so complicated that we have observed patient is unable to render it back after listening. So what I feel, the more comfortable thing is Om chanting. So if the patient is technically sound about the Sanskrit, there are some patients, they are particularly coming that we will do this and we are habituated. Even the simple like the Santana Gopala mantra and all, they are habituated. So as soon as we tell that no madam, we know this, every syllable I know, we render that. But when it is coming to this, you see it is very difficult. I think it may. It is the Meda Suktam. It's like the Vedic mantra pronouncing with the Labu and Guru Matra, it is there. And it is difficult, even we Ayurvedic practitioners cannot pronounce. This is the Vedic chanting of mantras. So when to start this? Om chanting, what I believe that entire 9 months you can ask the patient to chant the Om or whichever the short mantra is there. But some people says that I talked to Srivatsava from Mysore. He said that Vishnu Sahasranama is the best one. It is there in that tune. MS Subbalakshmi, this thing is there. So in southern India, particularly Karnataka and Andhra, Telangana, we listen to Vishnu Sahasra. That is there. Routine, but they don't know what is the raga composition. He said that that raga is suitable for the pregnant woman. And some people says Gayatri, but I believe that Gayatri is heat generating mantra. So we refrain from chanting of the Gayatri. I may be wrong also, but this is my the version. And Meda Suktam and Prajna Vivardhana, you can start as soon as 16 completed weeks, or even in the 4th month you can start, because Indriya Nirmana is not completed but started there. So I think we can start in the 4th month for the better. I talked to the mantra experts, he says that it is better to start in the 4th month. So Prajna Vivardhana is there, and that is to enhance the
यश्छन्दसां वृषभो विश्वरूपः छन्दोऽभ्योऽद्यवृतात् सम्बभूव सवेन्द्रो मेधया स्पृणोतु अमृतस्य देवधारणो भूयासं शरीरं मे विचर्षणं जिह्वा मे मधुमत्तमा कर्णाभ्याम्भूरिविश्रुवं ब्रह्मणः कोशोऽसि मेधया पिहितः श्रुतं मे गोपाय मेधा देवी जुषमाणा न आगाद्विश्वाची भद्रा सुमनस्य माना त्वया
अभी जो सुना है वो मेधा सुक्तम, ये सिंपल है प्रज्ञा विवर्तन वाला सिंपल लिरिक्स में. हाँ, प्रज्ञा विवर्तन स्तोत्रम. ओके, चलेगा. can listen to the Purusha Suktam. For this is for the physical development of the baby.
तच्छयोरावृणीमहे गातुयज्ञाय गातुयज्ञपतये दैवी स्वस्तिरस्तु नः स्वस्तिर्मानुषेभ्यः ऊर्ध्वं जिगातु भेषजं शन्नो अस्तु द्विपदे शञ्चतुष्पदे
It is more like Swasti Vachana. You can listen. I am not well versed in these mantras and all. We have to work on this further. Whatever the initiations, little initiations we have initiated, and I have gained knowledge from our counterparts that I am presenting here. And I hope you will come up with your own versions, and we'll have a SOP under the guidance of respected Sujata Kadam Madam, the SOP of Garbha Sanskara in future soon. Thank you very much.